So I'm Razvan Staniscu. I am the president of the Graduate Employee Organization, and today we're having a rally in support of living wages for graduate students here. If you guys don't know, graduate employees are TAs, teaching assistants. They're RAs, research assistants. They bring great value to this university, not just in terms of the classes that they lead, the labs that they lead, but the research they bring in, the grants that they bring in with their faculty members. We bring a lot of value to this school, and all we want is to be paid enough for transportation, enough for rent, enough for food.
I love the people who I work with. I love my department. I love the things that I do. I love being teacher assistant and research assistant, but I deserve livable wage. You know, I give something to the university as a service. I want to have an excellent service to the university, to the students, and to the research I do, but I need to be able to afford my life.
Since May, we've actually been bargaining directly with the university, and we meet every 2 weeks, basically going back and forth, trying to find a compromise. Right now, we're trying to meet a livable wage because for over 10 years, we haven't had a raise haven't had a new contract between 2009 and 2020. The contract we got in 2020 was a pandemic contract, and it was a small raise. But in that time, in those 10 years, we had over 25% inflation increase, and we haven't kept up with it.
We have a lot of people skipping meals, hungry every day because they can't afford to put food on the table. We have people in crammed living situations on top of each other because they can't afford a reasonable space because of the limitations of what we're paid.
And for any of you wondering, what is it like in other universities? Have you guys looked at other universities? Have you presented that at bargaining? Yes, we have. We have presented that at bargaining. We are an R2 university. That means that we have a certain amount of research dollars. We compare to other universities in the following way. They all make more money than us, or the average majority of them make more money than us. And guess what? Except for UMass Boston, they all have a lower cost of living.
Unfortunately, the university just kind of shrugs off those numbers and doesn't really want to address the fact that we are paid substantially lower than most R2 institutions. We've also provided testimonies from our fellow members in terms of the impact of our low stipend and lack of dental and vision care on their lives, professionally, emotionally, and just on their mental health more generally. And that strategy has also not seemed to take hold, unfortunately. They kind of just, they started to get sort of angry when we would have more and more people come in because we were trying to paint a picture that this is not one or two cases, this is everybody.
I am transferred student from Kansas State University. So in Kansas State University, my 9-month salary for TA was $18,000, while the housing cost there is less than half here. I swear, it's less than half here. So but here, my 9 months contract is not even 17,000. It's not even 17,000.
University corporatization has been gradually shifting the fundamental operational structures of universities since the 1970s. They are shifting from a public good knowledge regime to an academic capitalist knowledge regime. It means that universities have started following a business model and acting like corporations with an end goal of maximizing revenues and reducing costs. And one of the ways of reducing the cost is using cheap and vulnerable labor.
Surveying our members, we found that about 20% of our members have dependent children. About another 20% are caring for adult relatives, either physically or financially, sometimes both. And so it's not just a matter of caring for ourselves as individuals, but being able to care for people around them. I think that's a large concern for a lot of our members. And we've also found approximately 15% of our members are actually putting off having children because they can't afford it.
Our struggle is a class struggle because while some of the people in the top administration are making six-figure salaries and living in the comfort of their luxurious apartments, many of us, including me, spend days stressing over how we will afford our meals, how we are going to pay our bills, how we are going to pay for our medical and dental treatment.
In summer, I have received a 5,000 cost estimation from my dentist for dental care, and still like 4 months have passed by. I couldn't get that dental care because I can't afford it.
Really, the most important thing to us as graduate student workers is the stipend. For many international students, they're legally not allowed to work outside of the university, and so they can't make more than $15,000 a year, and they, during the summer, they have to rely on their PIs being kind enough to, give them the funding. And
We want university to care about their graduate students, especially the people who devote their life. We are young adults. Some of us has family, has kids. Many of us are international students like me, which are not allowed to work out of campus.
The issue at hand here is much greater than me. It's much greater than just the people here. It's much greater than my cohort, than my program. It's the whole university and the future of graduate students here at UMass Lowell.
we are here at these events, trying to just show that, our work really does have an impact on these students, on these faculty members, and, people are listening, they're watching.
We are building solidarity, and we are not alone. We have our graduate TAs and RAs as our members with our graduate employee organization, and we have support from faculty members and undergraduate students, and the numbers are our power, and we have the majority in our support. We'd like UMass Lowell to address the unlivable wage struggle that their students are going through, so that we can work at our full capacity and support the university